Well, it's 9 o'clock and welcome everyone. It's so glad to have you with us here today. My name is Rita Koutsoudiamos and I'm the Executive Director of the BC Alliance for Healthy Living. And we're just really happy that you could join us today for a really interesting program. But I would like to start by acknowledging that this webinar is being broadcast from the traditional unceded territories of the Squamish, Musqueam, and Tsleil-Waututh First Nations, where we have the privilege to live, work, and raise our families. So we're here today to discuss alcohol warning labels, which may be a way to bring awareness to the link between chronic disease and alcohol consumption, as well as a way potentially to curb excessive consumption. So according to Statistics Canada, nearly 1 in 5 Canadians, or 18%, reported consuming 5 or more drinks on the days that they consumed alcohol. And during the pandemic, British Columbians had reported a 25% increase in alcohol consumption. This increase in alcohol use is alarming, especially given that most people are unaware of the links with chronic disease. We know drinks with dinners at home, social gatherings, and celebrations are common for many adults in BC and elsewhere. But the prevalence and normalization of regular alcohol consumption in our society underscores the need for effective policy measures to reduce health harms. We have an excellent program lined up for you today with 2 great speakers. But first, I'd like to remind you or turn your attention to the bottom of your screen, and you'll see the Q&A button there. And so I just wanted to remind you that we really want this to be a conversation. And given that we've got these 2 great speakers, we want you to be able to ask them questions. They're really keen to speak about their research. And so treat this as an opportunity and do be curious and please use the Q&A button to ask your questions. We'll try and get through as many as we can during the session, but of course, if there are leftover questions, we will do a follow-up email. So with that, let me frame out our program for you today. So evidence shows that alcohol use contributes to a disease as well as mental health and social harms. Harmful alcohol use is a causal factor in more than 200 diseases, as well as injuries and other health conditions, according to the World Health Organization. And alcohol has been labeled as a class 1 carcinogen, which is the same category as tobacco smoke and asbestos. So besides well-known harms like car crashes and domestic violence, excessive alcohol use can lead to cancers, including cancer of the liver, mouth, throat, colon, and rectum, and of course, breast cancer in women. But we also know that it contributes to other chronic diseases such as high blood pressure, heart disease, and strokes and other digestive issues. So our speakers today will discuss how alcohol warning labels can spread awareness of those health harms and get people to potentially to rethink how much they're drinking. Our first speaker, Norman Giesbrecht, will speak about why alcohol warning labels are an important policy measure based on his recent research, which looked into the effects of alcohol warning labels in various jurisdictions, including Italy, the US, Canada, Germany, among other places. Our second presenter, Erin Hoban, will speak to us about the 2018 real-world trial study in the Yukon that she was involved with the Canadian Institute for Substance Use Research. And so she'll speak to the results that the team gathered and considerations for implementation. So now it's my pleasure to introduce Norman Giesbrecht. Norman is an emeritus scientist with the Center for Addictions and Mental Health Institute for Mental Health Policy Research. He is also an adjunct professor at the Dalai Lama School of Public Health at the University of Toronto. His work focuses on alcohol policy development in local, provincial, and national settings, risks and benefits of alcohol consumption, and the risk factors for chronic disease. I want to thank you today for joining us, Norman, and I will turn it over to you now.
Thank you very much. I'm going to share my screen if I can find it. Here we go. I want to have the Okay, here we go. Sorry about that glitch. I'm very pleased to be participating in this webinar today. I would like to acknowledge my co-authors, Emmeline Riesdorfer and Isabel Rios. This presentation is based in part on a project that we completed for the Pan American Health Organization, and which was subsequently reported in a review paper that was published in September of this year. There are many different types of alcohol-related harm, as was just said, many chronic diseases, 7 types of cancer, trauma, including falls, fires, home and workplace injuries, violence, including intimate partner violence, fetal alcohol effects, impaired driving, injury and death, and alcohol dependence. Many of the harms involve innocent victims, persons who did not drink over high or not at high risk levels. It has been estimated from an Australian study that these secondhand harms or collateral damage cost as much to society as do the more direct harms. Here's some data from 2017. I don't know if you can see the top of the slide. This is the most recent year from which data are available for both drugs. And there were about 18,000 alcohol attributable deaths in that year, and 3,922 deaths attributable to opioids. Now, the opioid deaths have gone up since then, and so have the alcohol deaths, but the numbers for the alcohol deaths we don't have available. The study is currently underway with regard to that topic. Why inform consumers? Is the top of my slide blocked? Sorry.
It's got the title is how,
okay.
It's a yellow heading, yeah.
Okay, sorry about that. So why inform consumers about alcohol? Well, there's a lack of knowledge of risks. Only about less than 50% of the populations know that alcohol is a carcinogen. I think in Canada, it's about 30%. In order to reduce the risk of harm, to counter marketing and normalization messages, and harms are extensive and growing, and individuals can make informed decisions if they know more about the risks of alcohol. How to inform consumers and potential consumers about alcohol-related harm. There are many channels for advising consumers about these harms. A number are listed here. However, there are challenges. Numbers 1 and 2 are very expensive if they are to be on a scale in order to have any potential to have an impact. Currently, only a minority of healthcare providers speak to their patients about alcohol. A 2017 Commonwealth survey found that between 10% in Newfoundland and 30% in Alberta of adults 18 and older across the Canadian provinces had indicated their healthcare provider had talked to them about their alcohol use. It is also challenging to counter the extensive and sophisticated marketing by the alcohol industry. 3, many alcohol policies are the opposite of precautionary. So it's a bit of a challenge to get precautionary policies in place. Promoting lower drinking guidelines is a great idea, but how to get them to the attention of the heavy consumers is also a challenge. Numbers 5 and 6 on this list are the most direct and inexpensive ways of conveying health harm reduction messages to the consumer. Why have alcoholic beverages have health warning labels on alcoholic beverage containers? Well, the consumers have a right to know about the health and safety risks. They can influence the decisions of young people, and they can stimulate discussions and deliberations, and an efficient way to communicate evidence-based information, and can complement and support other alcohol policies as noted here. Now, here is a type of labels. Not all labels will have all this information, but there could be messages about a potential risk associated with alcohol consumption. They could refer to one or more risks, refer to an authority such as the Department of Health, include text, pictorial, or both, have standard drink information, have lowest drinking guideline information, and also have nutritional information. According to the Pan American Health Organization, there are 43 countries in 2019 that had alcohol warning labels. In 2019, there were 28 countries in America with either mandated, and 14 for mandated, and 14 for voluntary labels. And the former 10 former USSR countries had some mandated labels. The majority of these labels have not been evaluated with regard to their impact on awareness, perception, intentions, or behavior. Here's an example of a mandated label for alcohol from Ecuador. And here is an example of a mandated label in El Salvador. And you can notice that it refers to excessive consumption, but it is not defined. And here is a voluntary label with regard to alcohol, and you can see that it does contain information on standard drink. It also has an image about alcohol and pregnancy, and not drinking and driving, and the drinking age. So this is our overview of our rapid review, which was conducted in spring of 2021. And you can see that we had 4 search engines from inception to 2021. And at the end, we ended up with 122 articles. And I'm not going to try to summarize 122 articles. I'm just going to provide a few examples. The research tended to be skewed to the US. There were 58 papers, Australia, Canada, UK, and a few other countries. There was a range of designs and methods, cross-sectional surveys, repeated surveys of representative samples, availability samples, focus groups, online and in-person experiments. Very few randomized controlled trials, or quasi-experimental design studies were found. Here's how we organized our analysis. They included, we had grouped by warning label requirements, and then perception and awareness of warning labels, impact on different populations, impact of different messages, public opinion on warning labels, alcohol industry and warning labels, and finally alcohol policy analysis. As you can see in this slide, there seems to be some support for the combination of text and pictorial message. It's not conclusive, but there seems some indication that this combination is likely to have an impact than just the images alone or text alone. Labels with lowest drinking guidelines and standard drinks facilitate more accurate estimates of alcohol consumption from an online survey of 2,000 in-between groups experiment. And image and text health warning labels depicted bowel cancer showed a greatest potential for reducing selection and consumption of alcoholic drinks. There's also some indication that strong causal language, such as be more effective from an online experiment. Alcohol selection was lower when drinks displayed with health warning labels that included an image. Perceptions of warning labels. It seems like the US warning label, this is used in both these studies, was reaching the intended audience, such as drinking drivers and impaired drivers, and also heavy drinkers, at least four times the odds of seeing the label in the study by Kaskoudas and Greenfield. Similarly, with regard to awareness, you can see that over time, most of the message was seen, a greater awareness of alcohol-related consequences, mostly aware of alcohol product label. And the heavier users, the group with the highest risk of problems described on the warning label, were also most likely to retain the content of the alcohol warning label. There's some extensive research on alcohol pregnancy and warning labels. Hankin published a number of papers on this topic. Awareness of US labels was highest among young adult females. Pregnant women were more likely to recall the messages on alcohol and pregnancy compared with non-pregnant women. Pregnant women were more likely to correctly identify the effects of prenatal alcohol exposure. Also, awareness was greater among current drinkers versus non-drinkers, high risk versus low drinkers, and susceptible never drinkers and non-susceptible never drinkers in a survey of 3,000 UK adolescents. And thinking about labels increased as is talking with others and drinking less in alcohol in White Horse in contrast with the comparison site. In the left-hand column of this slide, I have listed the potential components of an enhanced label. And you can see that large size or large font of text, contrasting colors, the pictorial, multiple risk factors, alcohol as a carcinogen, using causal language, refers to an authoritative source, standard drink information, and refers to lowest drink guidelines. Now, very few labels have all of these things. But if you look at the right-hand column, this is the US warning label, which is probably the one that has been seen by most number of people, as it's been around for a number of decades. However, as illustrated on the right-hand column, it only has a few of the components of an enhanced label. Nevertheless, as shown in the next slide, it had an impact on intentions, perceptions, and bringing information to high-risk drinkers. So you can see there was increased support for public warning labels, high-risk drinkers, more likely to recall the messages. Those who saw the warning labels are most likely to report several behaviors indicative of heightened awareness. Early after the introduction of labels promoted drinkers and high-risk drinkers to engage in more discussion about the risks. There was a relationship between response between the message recall and actions to deter another person's drinking and driving. And label supporters are more likely to claim that labels hadn't affected their drinking compared with non-supporters. So there seems to be some evidence that even the rather poorly designed, and this is because the compromises that had been made with the alcohol industry when they were introduced in 1999, either the poorly designed US warning labels had reached the intended audience and had some impact, at least on some aspects of the potential aspect. Now, what does the alcohol industry do with regard to warning labels? They seek to postpone or block implemented labels. And They, in Canada, for example, in the late 1980s and early 1990s, there were several attempts to have alcohol warning labels mandated. All failed to achieve government support. They were private members' bill. They went through the various steps and never really became legislation. In the last initiative in Canada, the federal minister of health at the time stopped it, claiming that the cost of the alcohol industry would be $10 million to change the label. Labels are changed regularly by the alcohol industry, and I really doubt that there's $10 million each time they change the label. They also promote voluntary labels that are vague or confusing. We came across 10 studies by the alcohol industry that put out their own labels, and that was typically the conclusion of the authors. They also promote alternatives such as education programs or play zone, drink responsibly type messages. Now, the latter, I imagine you've seen these on a very glossy, multicolored advertisements for alcohol products. And you would often see, at least in Ontario, we would often see, please drink responsibly type message on the bottom. I don't know if these messages have any impact whatsoever on the consumers. They also threaten legal action when they don't like the message. So I was asked to indicate, why do you think governments should mandate health warning labels on alcohol containers? Well, to emphasize health and well-being, emphasize that alcohol is a drug and is no ordinary commodity, reduce harm and costs related to alcohol use, and to support other policy initiatives, precautionary pricing, controls on outlet density, curtailment of alcohol marketing. Be responsible and avoid potential liability and costs. What can be done to promote mandated alcohol warning labels, warning labels on alcohol containers? 3 suggestions are offered here. Send clear messages to policymakers via letters and face-to-face meetings. Why they are important, that there is public support for them, that they are central to an evidence-based strategy to reduce harms and to debunk the myths that are being promoted about them. Engage stakeholders to build support through networks focused on alcohol-related harms, FASD groups, oncologists, alcohol and violence prevention groups, drinking and driving countermeasure groups, and others. And last but not least, seek legal action. Robert Solomon, in a presentation at a CCSA conference in 2019, indicated all Canadian manufacturers and suppliers have a duty to inform consumers of the risks inherent in the foreseeable use and misuse of their products. So I'd like to acknowledge the Pan American Health Organization and Marisol Montero, and also the CAPE group that I've been involved in for several years. And here's my contact information, and I'm happy to welcome some questions or comments. Thank you.
Thank you so much, Norman. That's wonderful. You know, originally I was going to ask you a question about the dream label, or the most ideal label if you were to be a policy advisor for the federal government. But I think, given your presentation, I want to ask you a different question. I found quite interesting, the question of recall. And the recall really seemed to be strongest amongst those who really need to get the message. And I'm wondering if there is any of the research studies looked at whether those that saw those labels changed their drinking patterns at all, and whether that's going for lower alcohol content, or fewer drinks, or any changes in behavior.
There were a few. I don't have them at my fingertips. There were a few, but of course the ones that had the biggest impact are the one that you're going to hear from Aaron Hoban in a few minutes. But most of the findings on the recall was awareness, maybe intentions to do something differently, and so on, and talk to others about alcohol issues. There was, as I indicated in one of the slides, some intention to try to persuade people who are drinking and driving to do less of it or to stop doing that. But there's not that strong evidence from the U.S. studies that people change their drinking behavior. And as I said, one of the slides, and many of the studies, many of the warning labels in other countries have not been evaluated.
Right. So that is a problem. So I have a question here. This will be a quick one. What is precautionary pricing?
Oh, thank you. That involves several things. It can involve having a minimum price, a minimum unit price, so that the liquor stores or liquor shops and the bars and restaurants cannot sell the alcohol below a certain price per standard drink. And it's been found from studies in Scotland, for example, and also in Saskatchewan by Tim Stockwell and others, that if you raise the minimum price, it has a beneficial effect on the situation. Another thing is raising the taxes on alcohol. There's extensive research on that from the U.S. example, for example, that the taxing of alcohol is a good way to reduce the harm and reduce such things as drinking and driving, chronic disease, and so on and so forth. So these are the main sort of levers, if you will. And the last one that I should mention is that alcohol should keep pace with the cost of living, so that as there's more money around to buy goods and services, alcohol does not become cheaper than the other goods and services.
Yeah, that's pretty consistent with some of the other evidence we have on those types of measures. I have a question here from Kate, who says, shocking to hear about the cost of changing the label, $10 million. Wondering if you could expand on that.
This was from a chapter in a book that I co-authored some years ago. Alan Ogburn was the lead. There was not much detail on that. It was just a claim by the then Minister of Health in 1996, claiming that he was canceling the proposal to have warning labels because, one, they weren't effective, which he was wrong on that, and two, the industry claimed was $10 million, and I don't have any further information on that. But my point was that, at least currently, the industry changes the labels all the time. I mean, they put labels out for Pride events, for example. They put labels out for on Christmas. They put labels out other social events and so on and so forth. Are they spending $10 million each time? I wonder.
Oh, very good point. Not to mention, let's have a little look at the profits as well, right?
Right.
So Robin here asked, thanks so much for sharing the presentation. I was wondering if you're aware of any studies on the prevalence of voluntary labels in BC or wider Canada, particularly the prevalence of voluntary labels that highlight a causal link.
What's the last one? That highlight what?
A causal link.
The trouble with some of the voluntary labels are that they're voluntary, and so that means that the strongest evidence with regard to alcohol, for example, is not often used or downgraded in there. There was a study done, for example, I think in one of the African country, and they found that the voluntary label didn't really have strong wording with regard to some of the risks and so on and so forth. So I think there's lots to be said for mandated labels.
Yeah, and you can't help but notice that even the please drink responsibly starts with please drink.
Exactly.
Right.
Exactly.
Yeah. I've got a question here from Joy, who asks, wondering about the data collected regarding the fairly graphic warnings that appear on cigarette packages. Is there anything to indicate that the smoking population changed their behavior as a result of the labeling and or stopped anyone from taking it up? How effective are labels?
Thank you. I'm not a tobacco research authority in any way, but my understanding is that the tobacco labels had a pretty strong impact on smoking behavior. But of course, at the same time, there are many other things going on. There were restrictions on where people could smoke. There were higher taxes on tobacco products, and so on. So I think that the when you have a combination of things like that, you have a great impact. And sometimes it may be difficult to tease out what aspect thing. But I think, you know, and as I said, I'm not authority on this, but I think if you look at the timeline as when the more graphic labels went in and where they went in, it may be possible to figure out there was some impact. But the general conclusion that I know of is that the use of labels on tobacco products have had an impact on tobacco use and initiation. I should also mention that it's curious to me and others, excuse me, that cannabis products have labels. Now, cannabis, as far as I know, doesn't produce 18,000 deaths in Canada a year. You know, and cannabis products have labels. Tobacco products have labels, so they both should have labels. But why doesn't alcohol have labels?
Mm-hmm. Mm-hmm. And I will just say, in terms of there is good evidence that graphic labels do make a difference, and to be really effective, they need to rotate and change as well, because people will get numb to them, and that's partly why the graphic labels have been so effective, is because they are graphic and they do depict the really harsh health harms that will come, and so there's just a lot of evidence that shows that they absolutely are effective, as Norman said, as one of a number of different policy levers, including education, pricing, access, availability. All of those together need to be implemented to be effective. So I think we have time for one more question, and we've got a couple others here, but we'll save those to the end. So I've got here alcohol warning labels. Yes, says Lynn, spirits, wine, and beer commercials seem to have crept back onto TV, and she notes here CBC. She asks, what's happened here? Thought this was federally banned years ago.
I believe about 1996, a decision was made by CRTC, which controls TV and radio programming, to allow spirits to be advertised, and it's come back pretty extensively now, and I've noticed increase in ads too. So I think that's a real challenge. And I think one of the challenges is that I'm not sure if the CRTC is very health oriented. I think the advertising of alcohol should be controlled by the Department of Health.
Excellent. Well, as I said, we've got a couple more questions, so we'll come back to those after we hear from Aaron. So thank you so much, Norman. That was a great presentation. Really appreciate it. And yeah, like I said, we'll come back to those other questions after Aaron has a chance to provide her presentation. So now I'd like to introduce our second speaker. Aaron Hobbin is a senior scientist with the Health Promotion, Chronic Disease and Injury Prevention Department of Public Health Ontario. She's also a collaborating scientist with the Canadian Institute for Substance Use Research and an associate professor at the Dalla Lana School of Public Health at the University of Toronto. Her work focuses on developing and evaluating population-level interventions for chronic disease prevention, specifically healthy eating, physical activity, and alcohol control. Aaron, as the principal investigator, led the 2018 study on the effects of alcohol warning labels in the Yukon. She's here with us today to speak about the project, the pros and cons of alcohol warning labeling, and hopefully encourage us all to support alcohol labels. Over to you, Erin. Thanks so much for joining us.
Thank you. Let me just get my slides on the screen here. Everyone can see my slides? Thank you very much for the invitation to speak today about our alcohol labeling experiment in Yukon. As Norman alluded to, Canada is a relatively high alcohol consuming country. In 2019 analysis, Canada was ranked 40th out of almost 200 countries for our alcohol consumption. And alcohol use continues to be one of the top 10 risk factors for death and disability in Canada. The Canadian Institutes for Health Information released a study in 2017 that received a lot of media attention because they did a really nice job of comparing the number of hospitalizations entirely caused by alcohol in Canada in 2015 and 2016 with heart attacks. And the results of their study show that in Canada, there are more hospitalizations entirely caused by alcohol than heart attacks in that year. Norman also alluded to in his presentation the cost of alcohol in Canada each year. So the most recent data that's been published shows that in 2017, alcohol cost Canadians almost $17 billion. And you can see in this graph on the slide that that's more than tobacco, as well as all other types of substances. A study that our team conducted among adult alcohol consumers in Ontario in 2014 asked consumers if they were aware that alcohol can cause a range of different health conditions. And the results are presented on the slide here. Only about 20% of Canadians knew that alcohol can cause breast cancer. 47% knew that alcohol can cause brain damage, mental illness. Almost 60% recognized the link between alcohol and heart disease, and then a high percentage recognized the harm that alcohol can cause a fetus as well as to someone's liver. Canada is not alone in terms of the low public awareness of the link between alcohol and cancer. A large global survey with more than 75,000 respondents who use alcohol from 28 countries, including Canada, found that 62% of these respondents reported the statement, "Drinking less reduces your risk of 7 different sorts of cancer," was new information to them. And interestingly, 40% of respondents reported that if they knew this information, they would change their drinking behavior. So why are alcohol warning labels an option to consider? Labels are a unique information-based intervention in that consumers are exposed to key health information and advice repeatedly at critical points of contact. So every time a person is purchasing alcohol, they'd be exposed to the label, as well as every time they're handling the container, whether that's consuming the product or pouring the product. Labels are particularly appealing because of their relatively low cost to regulators, their unparalleled reach among consumers, and their potentially higher exposure to high volume consumers. As we were just talking about in the discussion period after Norman's presentation, a large well-established evidence base indicates brightly colored tobacco warning labels that are large in size with large font, with images or pictograms and clear health messages can increase consumer knowledge of health risks, shift societal perceptions of product risks, and even change population behaviors. Canada is a world leader in designing effective tobacco and most recently cannabis product labels. However, alcohol is exempt from these label measures in Canada. And given the health and economic burden of alcohol in Canada, there's a real opportunity to consider strengthening labeling measures for alcohol containers. So my colleague, Dr. Tim Stockwell at the University of Victoria and I received funding to conduct the first program of research focused on alcohol warning labels in Canada. And our program of research first sought to develop evidence-informed alcohol warning labels, and then to test these evidence-informed warning labels in a real-world setting to determine if labels are an effective tool for supporting more informed and safer alcohol use. So this slide presents the 3 warning labels that were designed based on the first part of our study where we considered previous evidence, and we also conducted focus groups with a range of different participants across Yukon. And as you can see, these labels are bright in color. They were relatively large in size, so they were approximately 3 centimeters by 5 centimeters. We used large font and pictograms, and we included 3 rotating messages. So the first warning label included a health message linking alcohol and cancer. Because in our focus groups, the participants told us that this is new information to them, and they thought it would be particularly surprising and shocking to other consumers. The second warning label included Canada's low-risk drinking guidelines for men and for women. And the third warning label included standard drink information. The label on the screen here is the standard drink label that we used on containers of wine. We also had a label for spirits, beer, and 2-liter containers of coolers. Now, one of the reasons we use this combination of warning label messages is because there is evidence suggesting that the most effective message combination is a message explaining why people need to care about their alcohol consumption and then how they can reduce their risk if they do drink alcohol. So to test the impact of these warning labels, we designed a quasi-experiment. The one government-run liquor store in Whitehorse was our intervention site, and the 2 government-run liquor stores in Yellowknife agreed to be our control site. Our 2 main data sources included longitudinal surveys with adult alcohol consumers in both Whitehorse and Yellowknife. And our second data source included detailed liquor store sales data that we obtained from the Yukon and Northwest Territory governments. So we conducted our first wave of surveys with alcohol consumers in Whitehorse and Yellowknife in May and June of 2017. The plan was to then implement our intervention labels in the Whitehorse liquor store only for an 8-month intervention period between November 2017 and June 2018. And our control site in Yellowknife would not receive the intervention labels. And then to conduct our wave 2 post-intervention surveys among alcohol consumers in both Whitehorse and Yellowknife in May, June 2018 at the end of our intervention period. And then also to obtain the liquor store sales data from the 2 governments and the territories between November 2012 to December 2018. So we could establish a solid baseline period before the label intervention was implemented, and then have sales data for more than a year after the label intervention was first implemented. So we successfully implemented the label intervention in the Whitehorse liquor store on November 20th, 2017. And this is what the labels look like on the containers in the Whitehorse liquor store. Exactly 1 month after the labels were implemented in the White Horse liquor store, the industry strongly responded to this study, and the Yukon government made a decision to pause their participation in the study because of this strong response. And the industry's response received international media attention. So this story was published in the New York Times, the Wall Street Journal. Andre Picard covered it in his column. And some of the quotes from the media include, the liquor industry has concerns which include the legislative authority on applying labels post-market, the label placement and trademark infringement, defamation, and damages related to the message. The president of Spirits Canada was quoted as saying, a label connecting alcohol to cancer was a bit of an overreach. We're just not sure that putting the word cancer on a label is the most effective way to convey that information, which I thought was very interesting because that was the whole purpose of this publicly funded study. In February 2018, the minister responsible for alcohol in Yukon and the chief medical officer of health at the time, Dr. Brendan Hanley, made a decision to resume Yukon's participation in the study. And this photo is them at a press conference making this announcement. Now, resuming their participation was on the condition that the alcohol label was no longer in the label rotation, because the strong response from the industry was most focused on this cancer warning. So we did have to modify our study design. So we had already completed our Wave 1 survey data collection in May and June of 2017. Our labels were implemented for exactly 1 month before being put on pause. We decided to collect a second wave of surveys in February and March 2018 to try and capture any sort of initial impact of that first month of the label intervention. We then resumed putting labels on alcohol containers in the White Horse liquor store in April through July of 2018, and then conducted a Wave 3 survey data collection in June and July of 2018. And then we did obtain liquor store sales data from the two governments from July 2015 to December 2018. So the results of our longitudinal surveys suggest increased consumer awareness and knowledge of health risks, particularly the link between alcohol and cancer in our intervention site compared to participants in our control site. We also found evidence of increased consumer awareness and knowledge of the number of standard drinks in an alcohol container, as well as Canada's lowest drinking guidelines. One of the most interesting findings, in my opinion, from this study is that because of the longitudinal nature of our surveys, we were actually able to detect increases in consumer knowledge of the link between alcohol and cancer. And what we found was that as people learned that alcohol increases their risk of cancer, they had almost 2 times higher odds of supporting alcohol pricing policies, such as minimum unit alcohol pricing. And these types of pricing policies are often very unpopular among the public and also policymakers, despite the fact that there is very solid evidence that the pricing policies are one of the most effective types of policies for reducing alcohol per capita consumption and alcohol related harms. So this finding is often one of the findings that policymakers and decision makers really stick their teeth into, because it somewhat indicates that perhaps a more educated public would be less likely to push back against some of these more intrusive type alcohol policies. The results of the surveys also showed that the majority of consumers supported alcohol container labels with a health message, with the number of standard drinks in a container, and with national drink guidelines. This slide, excuse me, presents the results of the liquor store sales data. So using the liquor store sales data, we conducted an interrupted time series analyses. We used the liquor store sales data to calculate the number of standard drinks sold per person aged 15 plus from in the Whitehorse liquor store, which is shown on the solid line at the bottom of the graph. And then our comparison site for this analysis was the 5 liquor stores in Yukon outside of Whitehorse that did not receive the label intervention. And those standard drinks per person are showed in the dotted line at the top of the graph there. The blue shaded region is our alcohol label intervention period. And the results of our analyses showed that the alcohol label intervention was associated with an almost 7% decrease in standard drinks per person in Whitehorse compared to the 5 liquor stores in Yukon outside of Whitehorse. Now, our research team was quite surprised by this finding, particularly the magnitude of the effect of the label intervention. And so we actually repeated our analyses using liquor store sales data from the Northwest Territories as a separate control site. And the results were identical, which provided us more confidence in these results. Some of the limitations that I wanted to highlight from this study is that our intervention was interrupted after 1 month, and the duration of the total intervention period was shortened by 50%. So initially, we had planned for the intervention to be in place for 8 months, and in the end, due to the pause, the intervention was implemented for only 4 months. Our intervention was compromised to some extent, so we were required to exclude the cancer warning label 1 month into the 8-month intervention period. And we had also planned a promotional campaign with the Yukon Liquor Corporation, which included radio ads and in-store signage, for example. But this promotional campaign was also canceled and never implemented. And then finally, there's potential for contamination in our comparison site due to the national media coverage that this study received. The results of our study have been published in 11 peer-reviewed manuscripts, including 6 papers in a special series in the Journal for Studies on Alcohol and Drugs in 2020. And those studies continue to be the top cited papers in that journal for 2020. We also conducted a number of knowledge translation activities. So we held more than 10 face-to-face meetings with our partners in the territories, 9 national and international peer-reviewed conference abstracts, webinars, and symposia. We have a project website that is quite extensive and includes all of our materials. We've held now more than 5 invited presentations, had more than 50 media interviews. Our team also invested substantial resources into developing a policy brief, a lay summary, 4 beautiful infographics, a social media campaign, blog posts, press releases, and we've held a number of press conferences. And then we also developed 2 very detailed project reports for our local partners in the territories. The results of our study have also received significant global interest and uptake. So our results are being sought after and cited by researchers, practitioners, and policymakers around the world. As an example, the World Health Organization has invited Tim Stockwell and I to provide expert review for their recent report on alcohol labels. And at the start of December, we've been invited to participate on an international advisory committee on alcohol warning labels that the WHO has put together, and we get to travel to the UN city in Copenhagen to participate on this committee. Our results have also been strongly referenced in WHO webinars and international guidance documents. And PAHO had hosted a webinar series on alcohol labeling and strongly referenced our research in their webinar. In 2019, Fraser Health Authority in BC reached out to our research team indicating their interest in running a media campaign to educate their population about the link between alcohol and cancer, because in some of their surveys, their population indicated an interest in knowing more about the harms caused by alcohol. So I just wanted to share this because I thought it was really interesting. The campaign ran between January and March of 2020, and the two posters on the screen here are just examples of some of the materials that were part of the campaign and were displayed on SkyTrain platforms as well as bus shelters. And before I end, I just wanted to highlight some of the national media coverage that our study has received. So in January 2022, the CBC did a really nice piece called "Alcohol Can Cause Cancer, So Why Don't Most Canadians Know That?" And apparently it received substantial uptake. I will share my slides, so if you haven't seen it and you're interested, please do check it out. It's very well done. I would like to thank my research team. So Tim Stockwell, my co-applicant, we had a number of investigators from across Canada and the US working with us. We also had excellent research managers and very close collaboration with all of our partners. And we received funding from this work from Health Canada. And my last slide here is I just wanted to end on some of the alcohol labeling related research that our team is now working on. So we recently received funding from CIHR to experimentally test the gender specific effects of health oriented nutrient content claims and a health warning label on alcohol containers on consumer product perceptions and drinking intentions. So in other words, do consumers perceive products with nutrient content claims such as 0 grams of sugar or only 90 calories per can as healthier? And do they consume more of these types of products? And could an alcohol warning label potentially serve to counter some of these advertisements and promotions that the industry is using to promote their products? Thank you.
Oh, excellent presentation, Erin. Thank you so much for that. Really interesting to see that last, where you're going next in terms of the counter measures, right? The counterbalance and that, because certainly in social circles, I'm seeing that in some of my social circles. Just really interested in some of your work when you're looking, and I have to say, I think it's kind of ironic that the industry, what they did in terms of interrupting your study, as negative as that was in terms of your study, interesting that it blew up in the media and perhaps was not what they anticipated in terms of the amount of people now that do know, right, about the risks. But interested in your study in terms of whether you looked at higher risk drinkers or drinkers that were drinking above the guidelines, and whether there was any shifting that way.
So the liquor store sales data that we use to assess the impact of the labels on actual sales or consumption, we weren't able to look at the individual level. So it was only at a population level. So we're unable to determine, who exactly was reducing the amount of alcohol that they consumed. Okay,
thank you. We have a question here from Sylvina, who asks, are the labels still on in the Yukon?
Great question. And they are no longer on containers. My understanding is that Yukon has actually reverted back to their 30-year long-standing warning, cautioning about drinking when pregnant. Because that's a very important message for that government. What they have done, though, is the minister has written a letter to the federal Minister of Health asking for federal support. And my understanding is that the preference from provinces and territories is that although labels could be mandated at the territorial or provincial level, the preference is for labels to be mandated at the federal level. And my assumption is perhaps because the federal government may have more resources to manage the pushback from industry.
Yeah, absolutely. But we have another question here from Lori, who asks, how is it that tobacco and vapor products have been able to be legislated, including health warning labels, but not alcohol? I wonder, wonder if there are some strategies that could be used from those other places where it's been legislated.
Yes, so, I mean, I think that's a really great question. I do believe that perhaps alcohol is sort of lagging behind tobacco and now even cannabis because alcohol is so normalized in Canadian society. At the start of this presentation, Rita talked about how, alcohol is part of celebrations in Canada, whether it's birthday parties or weddings or anniversaries. It's often part of relaxing on the weekend or after a long day of work. And so it's going to require a real cultural shift in Canada. It's going to, ask Canadians to rethink about their relationship with alcohol. And I think that this is going to take some time. I do really like to position alcohol labels as a very critical component of a more comprehensive strategy, but for a more comprehensive alcohol strategy. But why labels are a critical component is because, as I was talking about in my presentation, I think as Canadians become more aware of the, really serious harms that can be caused by their alcohol consumption, starting at even 1 drink per day, they may be more open to thinking about, maybe it's not great that alcohol is being delivered through food delivery apps, or that I can access alcohol any time of the day, any day of the week. So, I mean, that's sort of the direction I'm trying to take some of this alcohol labeling research. It's not necessarily that alcohol labels are going to drastically change population level consumption on their own, but perhaps alcohol labels are going to support a more informed consumer, perhaps going to start conversations among Canadians about the link between alcohol and cancer, start conversations between parents and their kids about starting to drink alcohol. So, I mean, that's probably a bit idealistic, but that's sort of the direction that we're trying to position alcohol labels in some of the conversations that we're having with the World Health Organization, as well as policymakers here in Canada.
Well, that is a wonderful concluding statement there, Erin. And I do apologize. We've got a couple extra questions, but we have unfortunately run out of time. So, so thank you so much. That was a great wrap up, and you took some of my closing remarks there, Erin, about needing to think about this in a broad way as one strategy among others. And I think that the piece in terms of getting the knowledge first is just so critical, because as you noted, when you get that knowledge, then all of a sudden people are more open to some of these other accepting of things like pricing and limitations. There's that understanding, and it took us a very long time to make progress on tobacco because tobacco was a big part of our culture. It isn't anymore, or it is in some places, but so it is going to take a significant cultural shift. I would also just like to note that Senator Brazeau has introduced a bill S-254 in the Senate calling for warning labels on alcohol products earlier in November. So if any of you are so moved, it would be fantastic if one of the 105 senators received some sort of email or even just a quick voice of support to understand that there is public support for this measure. And so that's one little action item that you can all take. And I just want to wrap up by thanking so much to our presenters, both Norman and Erin. Just wonderful that you're working in this area and that you're willing to take some time out of your busy research schedules to share that information with us. Is so appreciated. Thank you so much for the work that you do. And thank you all to our audience for joining in and for your time and attention and some fantastic questions. This was a really great discussion. So thank you, everyone, and enjoy the rest of your day.
Thank you.